When I was in elementary school, my dad was diagnosed with melanoma. And so it's a field that really hits close to home for me. And I actually think it's a good thing. It keeps me grounded. When I'm interviewing my patients, it makes me think about them and their families and how their condition might impact their families. So I really want them to feel like they were heard. I really want them to know that they're valued, and I want to provide them exceptional care. I try to make the little things matter. I try to ask them how their day is going. I try to ask them about their kids or their upcoming travel plans. And I think those small conversations really put them at ease and reassure them that I have their best interest at heart. There are studies showing that from the 80s until now, the rates of basal cell, the rates of squamous cell, the rates of melanoma have all doubled or more. It's due to our lifestyle, really. It's our sun exposure, and I think focusing on prevention, focusing on the little things like putting on sunscreen can really go a long way to help keeping us and our population safe. Technology is useful, and it's getting more useful. Every day I use a dermatoscope, which is a magnifying glass with polarized light, to look at lesions and get a better idea of the vasculature and the individual characteristics of the lesion. And there's more and more technology coming on board about mole mapping, where you take photographs of patients over time and it identifies changes in the moles. I always tell my patients it's important to have a gentle cleanser, it's important to have a good sunscreen, a good moisturizer, and then a retinol product. And if you've got those four, you've got the foundations for healthy skin. The demographic I treat is probably 60 and older primarily, and so I've been doing a lot of skin checks. But I see a wide range from 6 months and up, so I see eczema in infants all the way to skin cancers in the elderly. I grew up in Yorba Linda, and now I'm practicing with Providence at their Yorba Linda site. And so really by seeing patients, I feel like I'm helping my community.